Good evening,
Yes.
everyone. Like every week, we are going to be starting our webinar today. Today's topic being data analytics in healthcare. So, to introduce our speaker, we have Dr. Danish Salim with us. He has done with his MRCM and then FICM. So he's having almost 13 plus years of experience in the field of emergency medicine. And he's been a faculty in multiple venues like conferences, 200 plus conferences all over the world. And he has presented some medical research articles also. He has held positions of Vice President of IMA in Kovalam. And also he's currently heading the Department of Emergency Medicine at PRS Hospital, that is at Trivandrum, and also the academic head now. So he has one interesting take. So he has invented something known as ASAP. Dr. Danish, welcome to the webinar platform. Will you just enlighten us about the ASAP you came up with?
Sure. So ASAP is a device which can be connected in car. I developed this on 2011 with the help of some engineers in Trivandrum. So this device which we can be plugged in the car so that it can detect the accidents. Now, like from last 5 years, 7 years, there are massive developments are going on and there are so many devices now. I got the patent from the Singapore and we have presented it in many countries, Abu Dhabi, Singapore, then Bahrain, and it was being accepted in many areas. So this is about accident smart alert device, which we have developed in 2011.
Okay, what's the current status? Is it still going on in Kerala or?
No, the Masdar University have taken my project actually. So they have taken they have taken all the inputs, whatever I have developed, I have sold to them actually because it was a financial. There was a burden for me actually. We were actually trying very difficult to sell it, so they took over. So the research is going on under their university.
Okay, let's start the today's webinar. Do you want me to share the screen? Okay.
If you can share the screen, it's fine because I would like to show the PowerPoint. So thanks for giving me an opportunity to speak here. Thanks, Dr. Srinath, Dr. Naveen. This is a wonderful platform, actually. I have seen the updates, what we are doing through the Canva. So wonderful, wonderful initiative.
Yeah, thank you so much. I think you are able to see the screen, right?
Yes, I can see.
Okay. This is the next session speaker, just to introduce you, Dr. Yashoda Sridhar. She'll be joining us next week. And for today, please go on, Dr. Danish.
Okay, thank you. So today we are going to discuss about something interesting, data analytics for healthcare. So why this topic? Because we should not be late in understanding. This is very much important. Like data analytics is like what to say, it is taken over all the fields of fields. It is taken over the, it was automated many companies. It is actually all the sectors are be automated. I'll tell you an example. When COVID came, we were to doing the COVID CT scan. So in many countries, including actually now I am working in Abu Dhabi, Sheikh Khalifa Hospital. So our patients were going into the like CT machine and the report will be coming without without a radiologist. So without the radiologist, the CT score, the COVID score, everything we are able to calculate. Within few seconds, the patient is going into the CT scan and the report is coming to us. So that's the importance of data analytics and data, the whatever automations which are happening in healthcare. So if you are not getting updated with this, actually we will be very much far. So we should know about what is data analytics, how we can implement this in our healthcare sector, and how we can change our current practice. So we are going to discuss few topics here. So what is data analytics? I'll just give you an outline and how it is changing the world. Why that as a doctor, why we should care about the data? What are the tools which are used in analytics? How we benefit by using the analytics. So these are some of the data which we are going to discuss today. So data is everywhere. We everybody is saying about data. We know that data is important, but hardly anyone knows what is data exactly. So in healthcare, the data means the patient demographics, the patient comorbidities, health status of the patient, the imaging statistics. Uh, so why the CT scan was they were able to predict, because they have analyzed thousands of patients. Then they found out that if the patient is coming with these many presentation, the CORAD score is this much, or the score is this much. So they were able to find out with the help of algorithm. So we need data to tell that this patient is having this. So all the data which we are having is very important in making our life easier in the coming years. So what is data analytics? So data analytics is a raw data which are collected and going through it to make conclusion is called data analytics. So next slide. So there are two types. You have to know about two types. That are data analysis and data science. So data analysis means it is a retrospectively done. That means you are examining a large data to identify the trends, and you are developing a charts and create a visual presentation to help the businesses or the workflow to have a more strategic decision. That is what data analysis do. Whereas data science is a prospective. That means you are dealing with the design. You are already changed something, or you are designed some projects, and now you are analyzing whether it is working perfectly or not. Most of them are predictive models. So that's the difference between data analysis and data science. Now, how it is changing our world. So you might have noticed you see only ads directed to your likes and dislikes in Facebook, YouTube, or any other platforms which you use. Everything is pattern analysis is being done by all these machines or all these softwares. The Facebook or the YouTube or Insta, all are collecting our likes and dislikes. This is called pattern analysis. There are some predictive analysis are there. For giving a simple example is uh, when your insurance is getting over, you are getting some pre codes or new codes you are receiving from someone who have not contacted you till now. So this is called predictive analysis. By predicting your data, they are predicting. This is a simple example I am saying. And trend analysis is like even without searching, the trend, the what is market is searching for, that is called trend analysis. So everything is fine tuned. The world now fine tune itself according to the data. So healthcare is also, actually we may say that in India we are not following it like data. We are not giving as much as importance like in US or UK. In US and UK, they are doing for every patient. They are collecting lot of information from them, and they are trying to make some algorithms. Radiologists, many centers in UK and US actually, they are having automated reports, and it is being corrected by a radiologist. Only one radiologist will be there. He will be checking all the reports whether it is ready or not, or whether it is correct or not. So these type of changes are happening throughout the world. So we have to understand there is lot of changes are happening in healthcare. So healthcare, I have taken only few examples. So there is, we know that many are addicted to opioids. So there are, not everyone is addicted to opioid. There are some risk factors for opioid addiction. So in a hospital, a physiologist is an institute. They have find out that there are 742 risk factors for a person to get addicted to an opioid. So if you know this before, and if you know this data, and if you know this before, we will try to avoid to patients giving opioids. So something like that is going on. And Barack Obama, the previous president of US, have collected data analytics for curing the cancer. He have already started like last 4 years or 5 years. This research is going on to identify the trends and treatment worldwide, and with highest success rate and all. The data analysis is going on. And there are so many such changes are happening. I have taken only few examples. Next slide. So in for metaverse, so there are a lot of things are happening in metaverse. So 20 minutes of virtual reality, we are getting around 2 million unique data. So when you see virtual reality, the machine is identifying where you are looking, how is your pupil reaction, how is your emotion, how is your response, everything. So 2 million unique data has been collected. So this is been used by many companies throughout the world. By 2032, it is estimated that the virtual reality, all those things will be very much high. Even it will be used in healthcare to relieve depression, to so many things they are using. Now itself, they are using for treating autism. Virtual reality is being used. So these type of technologies are coming up. Now, going into business, there are a lot of things. Coca-Cola is having the consistent, unique taste. Is not from its recipe. It's from analyzing more than 600 possible flavor combination of oranges and making a proprietary algorithm to ensure the consistency. So such things are happening throughout the world. Even the Amazon is doing. So many companies are doing, depending upon the data analytics. So this is a Telegram channel, I feel. So why doctors should care about data? So why I explained about the other companies, because we have to understand that there are a lot of changes happening in world in healthcare also, but we don't know much because of it is not being released. So every day without realizing, lot of data, tons of data we are losing. So uh, we can use this all those things to find out, to detect disease. For example, a person coming to an emergency department with a history of fever and diarrhea, there can be around 10 to 20 set of questions can be asked to him. So that 10 questions, if one is positive, again 5 sub questions can be asked. So machine or the data learning or the artificial intelligence can detect what sort of differential diagnosis even the human brain will not be able to, because we might have seen, I have 13 years of experience, so some may have 40 years of experience, but data analytics is like they are analyzing millions of data. So we will get something unique or something very much authentic diseases or differential diagnosis will be getting in front of us, and we can predict some genetic diseases. We can automate many hospital administration things like hospital beds, allocation of nurses, doctors, leaves. Everything can be automated. Not even a human intervention should be needed, and we can find, you can easily diagnose many things. You can predict the prognosis of certain diseases. You can find out the drug efficacy, uh, healthcare insurance processing, expediting the patient treatment. So many things can be done with the help of data analytics. So the tools used in healthcare analytics are basically, the healthcare analytics is divided into 4, as I have explained before. So one is descriptive analytics, another is predictive analytics, then is prescriptive analytics and discovery analytics. So descriptive analytics is seeing all the data collected in front of you. For example, you are managing a healthcare sector, or you are managing a hospital or a department. You are having all the data in front of you. So just 10 years before, we didn't have that before. Now we know, we have the dashboard with us. We know how many patients are coming, how many beds are empty, how many ICU beds. So everything is in front of us. So such we can include n number of things into it and find out the descriptive analytics based on the patient's disease or history. Then another is predictive analysis. So we are predicting the trends in patient flow or disease progression. So this was very useful while managing the COVID patients. So this is called predictive analysis. We are predicting the disease progression or the patient flow in a department, all those stuff. So we'll understand, okay, 6 p.m. or 6 to 8 p.m. there is a high inflow of doctor patients, and we need orthopedician to be there at 6 p.m. to 8 p.m. So by analyzing 1 year data or 2 year data, we are finding out, so this is what the hospital requires. So these type of analysis can be done with the help of this healthcare data. Another is prescriptive analytics. So we have to strategies to optimize patient care and slash errors. So for example, some even the junior doctors will be able to prescribe or treat rare diseases, or they will be able to diagnose some rare diagnosis with the help of data analytics. So the experience, it matters, but experience, more than experience, with the help of this data analytics, we'll be able to diagnose and treat same like an experienced doctor. So that's the importance of prescriptive analytics. And another is discovery analytics, to explore the new horizons of patient care and so these 4 together combined, uh, used in many healthcare areas to make it faster. So how ER can be benefited? Emergency department, we know that there are a lot of patients are coming to emergency department, and the acute presentation of any diseases are, we are seeing that. The emergency department are seeing these uh, all acute care, acute diseases. So we know, like we can find out which sort of patients we are getting, which specialty is needed in which hour, which which time more staffs are required. So those data we can categorize, and we can find out the patient flow, the patient transit time, the patient admission time, all those things we can find out. So resource management with automation can be done. We can find out the bed occupancy percentage on dashboard. So no more calling to check beds and all. That is one thing. And then next one, to predict prognosis using data that I have already explained. So you know the exact stage of progression with immunomodulators in an multiple sclerosis patient when they present with a relapse or to initiate treatment rightly. So this is one of the use of knowing the predictive prognosis. Another, if another outbreak comes like COVID, we with the help of this data analytics, we'll be able to control, so that faster and effective solutions can be made up, so we can reduce the burden of the disease. I have explained this before. Quicken the diagnosis and treatment with the help of data analytics. We can, even the junior doctor in night shift can manage same like a senior doctor. Without a consultant report support, he will be able to execute everything. And again, you can reduce the cost of care because most of the things are automated. Many things are many things which we are struggling can be automated with the help of data analytics. So there are a lot of emerging needs are there. There are so many future careers are there. So emerging needs, we can see in UAE, there are so many health data scientists are available now. So they are recruiting those who have some PhD in healthcare, and they are recruiting in many universities. So that is one thing. Health data scientist. There are some virtual hospital managers are there now. There are many patients are being admitted without being coming to hospital. So there are virtual hospital managers are available. Plastic surgery, 3D printing specialists are now available. Brain computer interface designers are there to counteract depression, post traumatic stress disorder, and all. There are some designers are there. PR surgeons are there. Synthetic organ designer. These are some of the predictions which we have for the futures, like VR therapist, medical drone designer, which already is there now. Many hospitals are designing the medical drones to deliver medicines and to collect blood. All those things, the medical drones are being used now. Health data security specialists are there now. Nanomedical engineer, cyborg therapists are there. Internet of Things analyst is there. So there are different future careers are there for aspiring MBBS doctors. So what you have to understand here is we have to be aware of the tools and changes which are happening throughout the world. If possible, try to acquire the latest knowledge. There are a lot of courses available in data analytics and artificial intelligence. Try to get trained because the world is changing very fast. You have to adopt and implement the futuristic strategies to grow and to make your department different and achieve unparalleled result by acquiring all this knowledge. So there is a new world unfolding around you. You have to understand it is happening in the healthcare also. If you cannot see it, it is actually a failure. So we have to find out that there is the world itself is changing around you. The healthcare is also changing around you. Within 5 years or 10 years, there will be drastic changes will happen in healthcare. Next slide. So congrats, you are now inducted to the world of futuristic healthcare. Just this is an insight, or this is a, like, what to say. I didn't go into depth of the data analytics. So just giving an insight, what is the importance of data analytics, how we can use. My number is being shared here. So you can see here, okay, my WhatsApp number is this. We have data analytic courses, which we are conducting in Abu Dhabi now. We have artificial intelligence courses, classes also we are doing it. So for mainly for doctors and staff nurses, we are doing this. So it's about data analytics.
Thank you so much, Dr. Danish. Medicine and technology they are like quite opposite when it comes to the staff. So the doctors don't know much of technology, and the technology enthusiasts may not be aware of the medicine. So those who know all both of these together will excel in such courses. So you're one of them. Glad to have you on board. If you have any questions, you may post in the chat box. We'll be going through them, or you can use the Q&A section. The topic is quite new to many of the audience, so they may not even know what kind of question to shoot probably.
Yeah, understood. So why I took this topic before, because there is actually multiple things happen here when I came to UAE. I have seen so many automations happening on, and they are collecting lot of informations here. They are trying to make it an AA. For example, in triage itself, they are trying to collect all the informations from the patient with 3 or 4 questions and some other clickable iPads they are giving. So the patient is just clicking all the symptoms, how many duration, everything, and the system will give the doctor what are the differential diagnosis. See how it is happening. So it's happening just maybe few hours, 3 hours difference from India. So this will happen for sure within few years. This will definitely will come to all parts of the world. So we have to get trained in this latest advances in healthcare.
Yeah, even without our knowledge, we keep giving a lot of data. We don't know what for what they are going to use it. Whenever you go to a shopping mall, they'll say there is a free lottery, and people just simply fill it out.
Yeah.
So they'll ask all your data. So they can be misused. Sometimes they will ask you simple questions like, "What's your mother's surname?" You're giving away your password reset questions there. So you have to be careful what kind of data you're sharing. And also, there is no such thing as free. Whether sometimes in WhatsApp you will be getting free gift from Flipkart or Amazon. So if they want to give you something free, they'll be doing on their own website, not some third-party website. So you have to be careful where you're sharing your data. They will collect your entire address. You will be thinking that you will be receiving the gift on that address, but you're giving away your full details to them. So be careful when you're clicking some suspicious links. So someone has asked a question, any RCT of effectiveness of AI implementation?
No, as far as I know, there is no RCTs now. But from last 5 years, there is a drastic changes happening. There are so many algorithms are in place, but there is no RCTs as such. So what I have collected is actually some informations I have with me, but it is, nothing is actually RCT.
What's the one thing that you are most impressed with the AI that's being used in the hospital you are currently using?
Yeah, the radiology is wonderful actually. See, at night 2 a.m., one patient going inside the CT room without the radiologist inside, and within a few minutes, we are getting the report of the patient without the radiologist means that is actually we are the doctors are being washed out, right? So that's it's a little scary to to know it. But in the
Was there
morning
any
they will be morning the doctor will cross verify, but night the emergency physician is getting a report of a artificial intelligence robot or artificial intelligence. So that sort of things are happening across the world.
there are occasions wherein the night radiologist is some young fellow. He might have given some report, and in the next morning we will get a different report from a senior radiologist.
Yeah, yeah.
So did that occur to you because of this AI anytime? Was there
Yeah, see, the AI they are using only for COVID. Not for any other CT in our hospital. So only they are in the CT report. It will be mentioning Corad score and how many lobes are involved. That much only the CT is reporting. So for that, I think till now we didn't get any wrong report till now. All the reports are perfect, but we didn't start using for other things. I don't know when they will use here everything. They are good doing many researches that I know.
So those courses you have been mentioning, you're having some courses and all.
Yes.
Do they get any kind of hands-on in them, or is it like live
We will
lectures?
be Yeah, we actually all classes are done by data analytics from different sectors. So we have from Amazon, one person, Amazon, I don't Amazon Web Service, AWS. The certificate will be AWS certificate, and they are giving examples for healthcare. They'll be giving a few examples regarding healthcare, and you have to solve it. It's an online class.
Okay, so one more question is, how can we implement machine learning in thesis if they're going for MEM or DNB emergency medicine?
Machine learning, or you want to data analytics? Machine learning, see, for machine learning we need to like, for example, I have done for my one of my resident have done a study. I have developed another system actually for the Kerala police. It is a software to detect all the ambulances across the across the Kerala. So we have 1,800 ambulances are there in one network called ANSWER, ambulance networking system with emergency response. So we implemented this in Kerala. So one of my resident have done this study. This is a MEM thesis study. So there is a device. So the device is capturing. That is machine learning. Machine is capturing all the data. So you have to make one machine, or you have to put some new software to the machine to grab all these data. Data analytics you can do without any expenditure. Data analytics is just collecting all the data and using it for the well-being of the patient, or well-being of the hospital, or well-being for the society. So that can be done. The other system, machine learning, you need some automation, or you need some machine to be developed. So it took around 1 year for us to develop that software. It is being used now. Kerala police have taken it. So they are using it, the software.
So same person, is it retrospective or prospective for any research purpose?
Better is retrospective for us. Retrospective is better, easy, and we don't know actually what we are looking for. So retrospective will be useful. And the other PG or 1 year, if you are able to do retrospective, another PG who is coming as a first year, he can carry out as a prospective. For example, he can. So we know we got the data. Now we can implement for example, we know chest pain. For example, there is a new study which are going on, pulse variability in chest pain. So that is going on in artificial intelligence. So when a patient comes with a chest pain to emergency department, the heart rate variability and the pulse rate variability, the machine is detecting, and they are finding out how whether it is pointing towards STEMI without an ECG. So this is there. If you Google it, you will understand. There are a lot of studies going on in heart rate variability and pulse variability in chest pain patients. So if you have these data with you, you can even do prospective. But without having the data, we cannot go a prospective study.
Okay, recently there have been devices like Holter monitoring devices. They're quite
Yes.
disposable. They're selling it for only 3,000 in India.
Yeah, 1-day Holter.
Yeah.
A
And
lot of things are
also,
there actually. Now IoT devices are there for those who are at home. Even Dr. Sharavanan from Mehta Hospital, they are actually having one. We have one in Dockstar. We have one. So it is a wearable devices for the grandfathers or grandmother at hospital. So they'll be wearing it, and every 5 minutes or 10 minutes we'll be getting the data. We can adjust it. So we'll be getting pulse. We'll be getting the saturation, and there is a BP apparatus which is kept in the room. So he can go and keep his arm over there, and the BP will be uploaded to the system. So such things are there. Then if he falls down, the IoT device will be activated, and with the alarm, the doctors or ambulance can go and treat the patient. So such devices are also available now. We have to keep our eyes open, read all these articles. Like healthcare is changing a lot, and emergency department will be actually, because we are always updated. So as a MEM students, they have to read all these latest articles and get updated.
okay, any good journals to track articles in this field?
I'll share some with you actually. I'll share with you.
Okay. So his WhatsApp number has been shared already. So you can see it on the screen now. So if someone has any questions later on, they may contact him.
Sure. This is actually my manager's number, but just tell that you are doctor and tell him. definitely will help you out.
Danish, very good session. I just have two queries. What you were asking, you were telling regarding the triage.
Yes, sir.
So, see, triage is always a what do you say? It's the patient who is entering the data, or is the nurse entering the data?
No, no. Sir, actually, this is a like we are giving some iPads to them. They
Hmm.
have to select they have to type the first symptom. When they type the first symptom, what will happen? For example, if I'm typing fever, then
Hmm.
other questions will be asked automatically. Then there are so many pop-ups will come. They will ask, you have to just click whether you have associated cold, cough, headache, diarrhea, vomiting, back pain, any other devices inside in your body. Such questions will be popped up. So he have to just click it. Then duration they will ask. So in less than 3 minutes, these sort of questions will be over. So then the differential diagnosis will be popped out to the emergency physician, not to the patient. So we will be getting the DDs.
No, but then the question is, it's a dynamic area, and whether this patient sometimes, if he clicks, if you have
Others,
fixed a respiratory rate as 20 as priority 3 and priority 2, if you mention it as 21, so priority 2. So again, it will become a difficult problem for both the emergency physician as well as the patient.
no,
So
yes. Tell me, sir.
so like this, how are you going to substantiate? Because it's a dynamic area, we all know that.
Yeah, yeah. The triage is being decided by the staff nurse only, whether it is a level 1, level 2, level 3, all those things are decided by staff nurse. What I'm saying is, before the patient comes to us, we are having a differential diagnosis with us. That is the only advantage of having this data healthcare. But triage, which triage level, all those things are decided by the ESI triage, the same triage system we are following here.
So have you analyzed the data? Because since you are already doing this one like triage, are you analyzing the data at least? Because I'm sure that it will be a big pool of data. So have you done any analysis so that that will be useful for the future triaging system?
Future trying, it can be used actually, but I am not looking. See, one doctor, Mr. Dr. Rubin, is in charge of doing this automation. So he's the one who knows all the data with him. I have not seen the triage data or the other systems, but all the feedbacks have been given from our side. What need to be changed? Some symptoms are being removed now. So there are symptoms. Some symptoms are not there now. So there are common symptoms are there now with us now, but many symptoms which are complicated are being removed. For example, a person who is having congenital abnormalities, like already he's having some hydrocephalus or something in this. So those patients who are having all this patient, we are not using these type of data. So normal patients who are not having such symptoms, we are using this data now.
The second is about the CT scan which you mentioned for the COVID patients. So how was it validated to give the report? Is there any validation method which you had utilized for it?
Every CT scan is being checked by the radiologist the next day morning, and it is actually countersigned, and the radiology report will be coming below to the report. For example, first will be it is a computer generated CT report. It will come. Then later on, the next day or within 1 or 2 hours, there will be another report which is coming validating this one. Validating. So every report is being validated.
So how many mistakes were there? Because again, it depends upon the data report which we get. So was it also been analyzed or not analyzed?
Yeah, that is been analyzed, sir, but I don't have the details with me. But I might have seen maybe 40 to more than 40, more than 50 patients I have seen, but I have not seen one error till now. Even all the cohort score, maybe 1 or 2 difference, but everything is perfect actually. Moderate pneumonia, all those things are mentioned correctly. The same report we are getting, whatever I have seen.
What do you think? So because you were using a lot of AI even in your department, as I remember from the emergency department. So, like using the ultrasound now, ultrasound is not a restriction in UAE, phone connected or anything. So, is it connected to your systems also? And so that when somebody does an ultrasound in your department, can you track it in your phone and look into the variations in the diagnosis?
No, sir. It is not been. It is not allowed here. I don't know why, but we are not able to access our files. Actually, I have permission, but many of the doctors don't have permission to access the file inside after leaving from the hospital. It is a
Okay.
higher. Yeah. So
Okay.
in hospital, ultrasound images we are recording and we are storing it in our system, and we are checking. We are all the positive cases or whatever we are finding positive, we are analyzing with the help of the real radiology report. That we are doing. That is a separate. One person is there to look after. If you get anything positive, all the positive the recordings are keeping it separate, and we are comparing with the original scan. Or if missed also, for example, a patient is having a fast scan positive and it is missed by a doctor and later on picked by the radiologist, this recording also been stored. Both are being checked.
Okay. Okay. Uh, the next question will be about your logbooks, everything. So, because the important is in emergency departments, the logbooks have been stored in a huge way. So, are you making any this one online data for the logbooks?
Yes, everything is online. There is no logbook as such. Everything is online, and it is being signed by the physician after every shift. For example, if I have so many PGs here, so they'll be doing a procedure. So they'll be mentioning everything in the software itself, and the physician will be countersigned, and it will be stored in iCloud. So the student can access it, but he won't be able to edit it. But the instructor or the educator or the HOD can see what all progress of the MEM student or the student, everything he can see from there. No book, sir. There is no book here.
Good. Thank you.
Okay.
Thank you very much, Danish. Okay. Naveen, if there is anything else, you can go ahead.
One. Yeah, I think that's it. Thank you so much, Dr. Danish.
Okay. This is mine. Yeah.
So you have his number. In case if you want to know more about this, you can always contact him. Okay. I guess we can end it here.
Thank you. Thank you so much.
Yeah. Pawan, you can close it.